Good evening, folks. This evening's topic D is the effects of vaping on elderly folks. So here we go with the presentation I made for you. Please sit back and enjoy. Is vaping as dangerous for older adults as for young people? The article argues that vaping is risky for everyone, but older adults face more severe consequences because of age-related vulnerabilities and long-term health histories. Below is a structured breakdown of the key points drawn directly from the page. One, vaping has caused serious illness and death across age groups. The article notes that vaping related lung injury has been tied to roughly 1,300 deaths, and about half were in people over 50. These cases often involve pulmonary injury linked to vaping devices delivering THC or nicotine. Why older adults are at higher risk. Even though many cases occur in younger adults, older adults tend to experience more severe outcomes. The article attributes this to cumulative wear and tear on the body, pre-existing lung or heart disease, longer histories of cigarette smoking, which means diminished lung function, reduced ability of older adults or older lungs to recover. A quote from the American Lung Association emphasizes that anything lowering oxygen levels puts extra stress on an older body. Three, what might be causing the harm? The article highlights several possible mechanisms. Damaging particles. A New England Journal of Medicine report found burnt particles in lung biopsies of people with vaping injuries similar to what's seen in tobacco smokers. This raises concerns that vaping devices themselves may release harmful fumes, possibly from solder additives and aerosols. Nicotine vapes often contain propylene glycol or glycerol, which are heated and inhaled. The article suggests that these may contribute to lung irritation, or injury. Increased risk of heart attack and gene changes. The article states that vaping may increase heart attack risk. Alter cancer-related genes in the mouth tissue. These concerns apply to both nicotine and THC vaping. Vaping and pneumonia. Recent research cited the article shows vaping can triple levels of molecular PAFR that helps harmful bacteria stick to the airways. This makes pneumonia more likely, and especially serious infection for older adults. Bottom line, according to the page, vaping is dangerous for all ages, but older adults face greater risk and more severe complications because their lungs and cardiovascular systems are less resilient. They often have pre-existing conditions. Their bodies recover more slowly from injury. Vaping may introduce harmful particles, chemicals, and bacteria-friendly conditions. The article's message is clear. Vaping is not a safe alternative for older adults, despite earlier marketing claims. Okay. Second act. Half. Exactly the kind of bridge topic you like to work with. Here's a concise, evidence grounded scaffold you can build on for a talk, handout, or episode. Framing the issue. Rising use, vaping, i.e., e-cigarettes, has expanded rapidly, including among adults who see it as safer than smoking. Core concern. Aerosols contain nicotine materials or metals and violate uh, organic compounds that can affect the brain through oxidative stress. neuroinflammation, and vascular injury, pathways already central to dementia. Key gap: direct long-term data linking vaping to dementia in humans are still limited. We're mostly interfering from mechanisms, smoking data, and early cognitive studies. You can name this tension explicitly marketed as a safer, but we're playing with partial instruments. Biological pathways connecting vaping to dementia risk. Nicotine and the brain. Short-term nicotine can intensify and enhance alteration and working memory via narcotic acetylene inhibitors. Long-term chronic exposure is linked to cardiovascular toxicity, blood-brain barrier disruption, and may promote neurodegenerative processes seen in Alzheimer's and other disorders, oxidative stress, and neuroinflammation. E-cigarette aerosols can contain heavy metals, formaldehyde, and other toxic byproducts that drive oxidative stress and inflammation, both central to neural injury and dementia. Pathopsychology, vascular, and systematic effects. Vaping affects cardiovascular and endocrine function, which matters because vascular damage is a major contributor to vascular dementia and mixed dementias in older adults. Okay, guys, that's your shows for now. I will see you later for shows. Until then, Gator Wellness, take care, folks.